inhibition about embarking on a subject like this was lost when I heard Michael Schill, president of the University of Oregon, a legal scholar and someone who, at least until 2 years ago, had rarely been to a football game, talk confidently about the Ducks' offensive and defensive strategies and tactics. So I figure I've got license. But I want everybody to leave here today knowing 4 key points. Spending in the healthcare sector will continue to increase. This is not a value judgment about whether it should increase. It's a conclusion based on underlying economic factors. Growth is inevitable. Your communities will be economically disadvantaged if you don't act to capture their fair share of the growth. Because healthcare will have an increasing share of GDP, public policy makers and the healthcare community have greater obligation than ever to work together to deliver value for the healthcare dollar. And creating the value that we want from the system will only happen if we collaborate, understand the true drivers of continued growth, and use evidence-based approaches to drive healthcare decisions. To the Canadians in the audience, it's no secret that the healthcare systems in the U.S. and Canada are substantially different. Different systems grow up as a result of different drivers. But as you will see, there are common economic themes to every system. The U.S. system is enormously complex and will remain so no matter what happens in Congress. The ACA has covered many millions of Americans, a critical factor for improved health. The central driver of reform has been the moral imperative to cover the uninsured and the working poor. This happens to have enormous public health benefits. Coverage equals health, and health equals wealth. If people are sick, they can't work and they can't buy. A healthy population is a working population. But the ACA is not perfect. Universal coverage is the foundation of improved public and population health, but it's not the whole house. For instance, I'd like to see us use statistical models and evidence-based medicine to drive what we're paying for so that we get the most for our healthcare dollar. But that's not the conversation that's happening in Washington. Other countries do a better job of using evidence-based approaches, and it makes a difference. Putting aside the current legislative uncertainty, there are underlying economic factors that say the healthcare sector is going to continue to grow in the U.S. and in Canada. After all, the laws of economics are as immutable as the laws of physics. 1, the U.S. population is growing, possibly by as much as 10% over the next decade. During the period 2011 to 2016, Canada had the highest population growth in the G7. Population growth equals healthcare growth. 2, the populations of both the U.S. and Canada are aging, and we all use more healthcare resources as we age. 3, certain diseases like diabetes and obesity are becoming more prevalent, meaning more people will seek treatment for chronic conditions. 4, there will be lots of medical advances. New techniques, technologies, and services create new demand, and we are in the golden age of biomedicine. Finally, we know that when individual incomes rise, those individuals tend to spend more on health care. This is known as a positive income elasticity of demand. And this is perhaps the most important reason the industry will continue to grow. One way to think about spending on healthcare and health is to consider it an investment in both longer and better life. To put it in strictly economic terms, the marginal utility of life extension does not decline. There is no limit to the amount one would spend, if one could, to extend life. Therefore, increased spending on health is a rational response to changing economic conditions. As any economy grows over time, the healthcare sector will not only grow, but will grow faster than the economy as a whole. As healthcare grows, the sector will play an ever more important role as a source of employment in the broader economy. Over the past 10 to 20 years, healthcare has been one of the most most reliable job creation engines in the U.S. economy. From 2004 to 2014, healthcare employment increased 21%. Some have even said that healthcare brought us out of the Great Recession. During my tenure on the Portland branch of the San Francisco Federal Reserve Bank, those from other industries on the board had one constant refrain. They were increasing automation, increasing efficiency, and reducing employment. Healthcare was consistently the only sector adding jobs. I would contend, in fact, that the U.S. economy is addicted to healthcare, and this won't change anytime soon. Some argue that 17% of the U.S. GDP is too much to spend on healthcare. What is the right amount? I don't have the answer, but our economy is always changing. In agrarian days, for example, perhaps 90% of GDP was spent on food and shelter. In 1960, the personal computing sector was essentially zero. Fixing a cap on healthcare or any other sector based on current trends just doesn't seem to make sense economically or historically. Consider another example of the ever-changing economy. Google and others are now several years into development and testing of a self-driving car. Freightliner is testing a self-driving transport truck. While this sounds like a glimpse into an exciting, Jetsons-like future, there are massive implications for our society. In 2014, there were 1.6 million American truck drivers, the #1 job in 30 of the U.S. states. There are also delivery truck drivers, taxi drivers, Uber and Lyft drivers, and bus drivers. A handful of other downstream activities puts the total number of jobs at risk in the neighborhood of 4 million. The real question is, will the loss of driving jobs have a social and political impact like the loss of manufacturing jobs? I don't believe that we know. What we do know is that with continued automation and efficiency, new jobs created are disproportionately in the service sector. Within that sector, healthcare offers a wide range of good-paying, family wage jobs and benefits the health of the community. In fact, I would contend that your communities will be disadvantaged if they don't act to capture their fair share.